that or heard about that being done because the fat is mixed in with it. They use the blood saver machine in like open heart surgery and liver transplants and stuff like that. If you have lost that much blood, it's time to stop the liposuction. You shouldn't keep. I don't agree with people liposuctioning you to the point of needing blood. That's too much. That means they should have stopped sooner. That's my thoughts on that. Getting blood transfusions from other people has its own risks, and I'm not even necessarily talking about transmission of disease, but also like transfusion reactions and stuff like that can kill you, which is rare, but when it happens, it's bad. And I don't think we should be putting ourselves at risk for things like that for liposuction. The strawberry laser, I don't think it's any good. I think those ultrasonic cavitation machines are good post-op, but those are not, I don't think those things do very much. Visceral fat and upper belly fat, you need your surgeon, your plastic surgeon, to help you determine those two things. One simple way, you might have both. You can't pinch visceral fat though. There's lots of options for losing weight. Obviously diet and exercise are good choices. There's lots of other other things that people do, like HCG diet, or sometimes they'll get a prescription from their doctor, but that's something you can talk about with your doctor, or do it the good old-fashioned way and cut calories and exercise. Yeah, Deanna, I feel like if you shouldn't be needing a cell saver machine to get liposuction or cosmetic surgery. That means that, in my opinion, that means somebody's doing too much surgery. You should not be putting yourself, it shouldn't be that aggressive. Cell savers are used in life and death operations. And cosmetic surgery, you shouldn't be doing it to the point of life and death. I'm morally opposed to that type of stuff. I do virtual consults, yes. I tell people to be within 10 to 15 pounds of their goal weight before getting a plastic surgery procedure. They're saying it'll help with faster recovery because they're putting the blood back. That you lost too much blood, and when you don't have blood, you can't heal. Like, so nobody should be all that. That's aggressive lipo and all this. Like, I hate that phrase, aggressive lipo, because that basically means somebody is over liposuctioning you a lot of time, in many cases. And you should not be getting liposuction to the point of needing a cell saver. That is ridiculous. Like, that is not good. This is why women die so much now. It's way too common. Death is way too common now. It's not normal. It did not used to be this way, but it's abused now. And now people think this is normal. You shouldn't even know that word. Like, you shouldn't even know what a cell saver is. They use them for liver transplants and open heart surgery. Nobody should need a cell saver for liposuction. It's ridiculous. People have lost their way. Some doctors have lost their way, and the patients didn't ever know where they were going in the first place, and they just following this foolishness. This is the stuff that makes my blood boil. No one should be using a cell saver for liposuction. That's ridiculous. Stop. It means too much lipo. It means you needed to lose weight, or they're trying to do too much in one setting. That's what that means. Blood transfusions, cell savers, no. It shouldn't be planned blood transfusions for your liposuction. I'm not saying I would never transfuse a person with lipo. I haven't, but I'm not saying I never would, because if it turns out that a person hemoglobin gets too low, then I will transfuse them. But I do everything in my power to make it so that they don't get to a place where they need a blood transfusion for liposuction. The gluteal contouring, you would have to get liposuction. usually I haven't done gluteal contouring on a person without liposuction in other areas. So usually it's an add-on. So I'm thinking if you got one area in gluteal contouring, it'll be somewhere, it'll probably start at like 5K or something. It just depends on how many other areas you get in liposuction. If you got liposuction at the time of your first tummy tuck, then you need to wait about 9 to 12 months before you get more lipo. But if you didn't get lipo and all you got was a tummy tuck, you can get it sooner. Yeah. Okay, let me see if I missed any other questions. I think I got everybody. Looks like I got everybody's questions. All right, y'all, I guess I'm going to tune out. Oh, wait a minute. Here's one. 1 month post-op, belly looks big in the middle, but it's hard. Everyone says swelling. I want to know when I can feel like I did something, LOL. Yeah, I'm not sure how to answer that question, Stephanie. I'm not sure what you got done. I'm not sure. But, I always encourage people to compare themselves to themselves, though. If you're comparing yourself to somebody else's, or you have an image of somebody else in your head, put a picture of yourself up to a picture of yourself before surgery up next to a picture of yourself after surgery, and make your decisions from there. Don't do it based on somebody else's outcome. Oh, so previous DVT and mommy makeover, or any plastic surgery. If you've had a DVT before, that is a sticky situation. It's not an absolute no, but the few people that I've had, like I made them, it was kind of like, why did they get the DVT? And I had to get clearance from their hematologist before we proceeded, and they probably ended up taking blood thinners after surgery and stuff like that. It's not an absolute deal breaker, but if you made a DVT once, then that tells us you can make it again. So your risks are definitely higher than a person who hasn't had one. For tummy tucks, what post-op garments do you require? I have my tummy tuck patients, they either wear these post-tummy tuck underwear that goes all the way up to right below their boobs, or they wear the compression garments that we put people in for lipo. And they wear them for a few months. Phyllis, I think strawberry lipo is a waste of money. It's a waste. Lipo of $190, that's $100 or $199 is not lipo. It's just people. I have not met a person yet that got that and was like, ooh, they always end up in my office getting real lipo. After I had a tummy tuck March 2016, I had a BBL and DR. Had to have a transfusion. So it was too soon, wasn't it? It might not have been too soon. I don't know when you got the BBL. It might have been that they over liposuctioned you, and that's why you needed a transfusion, because from what I hear, that's kind of common there. They commonly over liposuction people, which is why they have lots of deaths and blood transfusions. And then if it was too soon, they should have, your blood level should have been checked. So if you were at a normal blood level before the surgery and you needed a transfusion, it had nothing to do with the other surgery. It had everything to do with the surgery, that current surgery. Yeah, it's not necessarily the timing. 3 months is plenty of time. It was probably overdone, but I can't speak on that because I wasn't there and I don't know what happened. All right. Okay, y'all. I guess that's all I got. I'm going to go ahead and turn in. So, I am Dr. Myla Bennett of Addict Plastic Surgery and Medical Spa in Johns Creek, Georgia. And if you want to reach me, you can reach me via my website at www.adderabella.com, or you can call my office at 678-325-0006. And please, please, please share the video. And you can put in the comments if there's some other topics you want me to talk about. Otherwise, I'll just keep talking about stuff I see in my timelines. All right, everybody, you guys have a great night. Bye.